right away. I will be sharing the screen so that you're able to see everything that will be there. Okay. Right, acute viral hepatitis. This is at the end of the learning experience this morning. You are expected to gain the following points. One, list the viruses that are transmitted by fecal-oral route and those by blood and body fluids. Recognize symptoms of viral hepatitis in general. Identify laboratory techniques that are recommended for testing those who would present with acute viral hepatitis, and discuss simple management strategies for acute viral hepatitis. We shall recognize and stay with the hepatotropic viruses. In other words, there are many viruses that can cause inflammation in the liver. However, for those that have a predilection to cause predominantly liver inflammation, they are called hepatotropic. We have A, B, C, D, and E. There's 5 of them. However, we know there are some investigative ones, but we stick with these ones. Hepatitis A, in other words, before I go into that, the nomenclature A, B, C, D, and E is not graded due to severity. It is just for convenience, okay? Hepatitis A infection is caused by the virus known as hepatitis A virus. Very simple. It's an RNA virus, and I'm going into these details because some people joining us desire to know some basic virology. So hepatitis A virus is a member of the genus Hepatovirus in the family Picornaviridae. It's usually transmitted by the fecal-oral route, meaning that somebody who has contaminated their hands or and then contaminated another person, or has drunk water that is contaminated by the hepatitis A virus will get the infection, okay? For hepatitis B, it's a member of the Hepatnaviridae family. It's a small DNA virus with unusual features like HIV, okay? It replicates, in other words, multiplies through an RNA intermediate and can integrate into the host genome. In other words, it gets into the DNA of the patient, okay? The unique features of the hepatitis B viral replication cycle confer a distinct ability of this virus to stay in infected cells. Now, this will imply a lot when it comes to the reason why it is very difficult to clear the virus hepatitis A from the system. But the scenario for hepatitis B, acute hepatitis B, is a bit different from chronic hepatitis B infection. The C virus is a single-stranded RNA virus in the Flaviviridae family. It causes acute hepatitis with a high likelihood for chronic inflammation. In other words, most patients with acute hepatitis C tend to go on to developing chronic hepatitis C. For the D, it's a delta virus, okay? It has a defective RNA particle. It usually requires the B surface antigen for it to multiply. In other words, it does not survive when there is no B, okay? It is a small spherical particle that requires the B surface antigen. It is not known to cause acute inflammation, okay? But fulminant hepatic failure, usually it complicates those who have hepatitis B infection. The E is an RNA, so remember A, C, D, and E are RNA viruses, but B is DNA virus, okay? E is an RNA virus classified under the family Hepaviridae. It transmitted fecal-orally. So A and E are fecal-oral transmitted, okay? Whereas B, C, and D are by blood and blood products, okay? Most of it occurs in a self-limiting nature with frequent epidemics. Hepatitis E carries high mortality in pregnant women. That is very important to note. Okay. Now let's talk about the symptoms of acute hepatitis. Okay. Most of these symptoms will apply to all of them, but the dramatic ones will occur in A and E. B also relatively, but C may pass unnoticed. D, viral infection, like I said, will happen on the background of B. So hepatitis A is self-limiting infection. It occurs, the symptoms in about 70%, 7 out of 10 persons will have the symptoms. Children under 5-6 years of age do not manifest with symptoms commonly. They are non-specific symptoms like nausea, vomiting, anorexia, fever, malaise, tiredness, dark urine, pale stools, jaundice, okay, red, that is yellow eyes or skin, depending on how light-skinned you are, and then itchiness of the skin. When you examine the person, you will find that their eyes are yellow, and there is some tenderness in the right upper abdomen. The liver is slightly enlarged, and in some cases, the spleen is also enlarged. For B, again, like I mentioned, similar, okay? Similar symptoms. So nothing, we're not dwelling too much here. For C, acute hepatitis C does not commonly present with symptoms, like I mentioned. So many people go unnoticed, and the first presentation is when they come with complications, except in countries where there are routine surveillance and screening tests. So 80% of patients with acute viral hepatitis C do not exhibit any symptoms, only 2%. Those who are acutely symptomatic may exhibit fever, fatigue, depressed appetite, and the other symptoms we have mentioned. For D, again, these will be very severely sick because they already are decompensating from a chronic inflammation from hepatitis B. So the symptoms will include yellow skin or eyes, upset stomach, pain in their bellies, they vomit, fatigue, and maybe a kind of anorexic, not feeling hungry, joint pains, and dark urine. For acute hepatitis E, the same as for acute hepatitis A. Of course, these A and E cause only acute viral hepatitis. And so when we talk about chronic hepatitis, viral hepatitis, we are going to be talking about B, C, and D only. Perfect. Right, so what do you do when a patient comes with this kind of infection and you think that acute viral hepatitis is ongoing? When you do a full blood count, you're going to identify that one of the cells known as lymphocytes will be elevated. It is relatively, in other words, sometimes the total white cell is fine, but the lymphocytes will be high. And the reason is that lymphocytes are the types of cells that are driven to come and fight viral infections. And so their levels go up in blood. Liver function test will come with elevated serum aminotransferases. For those who have followed my teaching, you will remember that I actually always dealt with ALT, and I explained why ALT is more preferred to AST. Alanine transaminase is within the cytoplasm of the liver cells. And so when the liver is inflamed, the liver cells are damaged. And the ALT will then go into the bloodstream, and when the test is performed, the level is high. AST, on the other hand, is located in other cells as well. That includes being within the red blood cells and also the heart muscles and so on. And so it is non-specific. If you have to interpret ALT versus AST, or you have to choose between which one to test going for ALT, bilirubin will rise also after liver enzymes elevation. If you go on to immunologic assay, it is the antibody to hepatitis A that will be relevant. The IgM, which is the recent infection evidence, will be erased. But anti-HAV immunoglobulin G represents past infection or somebody who has been vaccinated. Okay? There are other tests as well, like ultrasound, which will just tell us of an inflamed or a bigger liver than it should be. But there will be no evidence of tumor. Hepatitis B, same. Okay? But let's go to the immunologic aspect, which is this one. The surface antigen is diagnostic of ongoing infection. Anti-hepatitis B co-antibody, okay, indicates recent infection. That is the IgM. Remember, M, recent infection, G, past infection. Okay. The HBV DNA is present. That is the evidence that there is active viral particles within the body. And it is present. This is because it's an acute infection. There are chronic carrier status of patients who in chronic infection do not have HBV DNA in their blood or they are undetectable. But in acute viral hepatitis B infection, this level will be high and it will be detectable. The E antigen may be positive and important. It's not important for diagnosis, but remember, I've mentioned again, E antigen is present if the virus infecting the individual is the wild type virus. The mutant forms do not produce the E antigen, and so it may be negative. Okay, I say this again for medical students and trainee doctors who really want to know about the detail on how to discuss when it comes to discussing about the E antigen. Right. Again, more tests there for imaging when you need to. When we come to C, let's go on to immunologic again because every other thing is similar. The anti-HCV antibody may be positive, okay? Maybe, reason because many times it may not be because it's too quick and it may not be enough time for that to be detected. But it takes a high index of suspicion for a doctor to go ahead and request this test. The HCV RNA will, on the other hand, be positive. Okay, because this is evidently the reason why the patient has hepatitis C. That is the virological evidence of it anyway. On D, the only test that will help is the anti-HDV on a background of somebody who has surface antigen positive outcome. Remember, this virus does not survive without the surface antigen. So important that you recognize that. Go to E is anti-HEV antibody, which will be important again. So remember, everything else similar, but the immunologic assays will differ. Perfect? Right, so enough of that boring lecture. I will go on to talking to you about how do you treat them. I'm sure many people will recognize the importance of treatment for these viruses. For many of you, your interest, how do you treat, which is fine. Many people who would be involved in the treatment will be doctors, community health officers, and those who would come in contact with these patients at the time of infection when they present to hospital. But some patients are confused as to what should be done. It is not uncommon to see patients who go to hospitals because of acute hepatitis infection and are given very potent medications that they don't need. Okay, so for A, the treatment is usually supportive. Bed rest, give them fluids, and pain relief medications. Cholestyramine, if you have it in your center, can be given to reduce the itching that the patient may present with. Although we say hepatitis A is not a very chronic infection, or neither does it cause chronic infection, there are occasions when it causes the following complications. Cholestatic hepatitis, relapsing, in other words, after some months, it will come back again, and very rarely autoimmune hepatitis, which is recognized as a cause of a chronic inflammation of the liver. So these should be recognized. But in fairness, it does not have any problem with chronicity. Let's go to hepatitis B. How do you treat them? These are most likely to be encountered in developing countries, but in most instances, adults do not present commonly in developing countries. In the developed country, yes. So if you encounter a patient who has acute hepatitis B, what would you do? Non-specific again. This treatment is aimed at relieving the symptoms of the patient. Rest from routine duties. Give analgesia, such as paracetamol or ibuprofen. Many people are afraid because paracetamol causes, in large amounts, can cause liver damage. And so some person may require to reduce the dose of paracetamol to half the amount that the patient would normally need. Antiemetics such as metoclopramide should be taken on demand. In other words, if somebody is feeling sick, you can give them some anti-sickness medications. Do the surface antigen regularly, but in most important case, month 6, that is 6 months from the time the patient presents, will be important to define whether the patient has gone on to having chronic infection or they have cleared it, in which case you define a past chronic infection. So if the surface antigen is found 6 months from the initial time of presentation, then the patient would be defined to have chronic hepatitis B infection, the management of which is different. We shall consider down the line at about in about a few minutes from now. Now, patients have been falsely given medications, including lamivudine, tenofovir, and some other medications. This is not to be given. Most people will not need it. But if there is evidence of fulminant hepatic failure, in other words, if the liver is failing to produce the functions it would normally do, then there is room to give these medications, in particular tenofovir, after which you aim at stopping it depending on how the patient recovers afterwards. So remember not to be given medications if they are in acute hepatitis B stage. Of course, many of you would have asked me questions about, okay, I will reserve that time for when you ask questions really. For D, for C rather, treatment during the acute stage does not change the risk that the patient will progress to chronic form or not. This is a very difficult case here. An acute infection may resolve on its own without treatment, okay? But patients with acute hepatitis C tend to have a high chance of progression to a chronic infection. The good news is that we will know later that chronic hepatitis C infection is curable. And so, but before now, it was not. So it is important that the patient is monitored and to see that there is hepatitis C clearance from the blood. Now for D, it complicates existing chronic infection by hepatitis B. There's no specific treatment for acute infection by D, apart from the non-specific management that we have highlighted earlier. Again, think about this. Now, for E, no specific treatment. Rest, fluids, avoid alcohol beverages, analgesia, admit to hospital for monitoring. If somebody is pregnant, and usually because hepatitis E occurs in epidemics, if there's pregnancy, please get that woman to hospital because the chance of deterioration is very high and supportive care with the help of an obstetrician will be relevant, okay? How do you prevent these infections? That, again, is very important for many of you. Vaccination is available for 2 of these viruses, B and A, okay? For A, you vaccinate, especially if somebody is traveling to a country where there is high prevalence or an ongoing epidemic. You improve the living conditions of developing countries. Environmental sanitation has been very key in reducing episodes. I remember when we grew up, there were many times that we have had several epidemics of hepatitis A infection. Nowadays, those are rare because sanitation has improved greatly. Safe drinking water sources will be relevant as well. For B, what do? Vaccinate, okay? Don't share sharps, instruments, post-exposure prophylaxis, screen bloods before transfusion, and prevention of mother-to-child transmission of hepatitis B. There is a video here for those who would have access to the materials to play. If I need to play this, it's going to take a long time. And so during this tutorial, I will not play that. I'll leave it to the person who will get this to do. Okay? C, never share needles. Intravenous drug users have a highest chance of getting the C virus because they share needles. Avoid blood-to-blood products transmission except they have been screened and cleared of hepatitis C. Don't share personal care items such as toothbrushes, personal items, or sharp objects. If you are prone to having tattoos, make sure you choose where you go to carefully to get those. Practice safe sex, especially if there's a background of HIV infection that includes the use of condoms and barrier methods. How do you prevent D? Practice safe sex, avoid dental, medical, or cosmetic procedures that penetrate the skin with unsterile instruments. Use latex gloves if you're likely to be in contact with someone's blood or bodily fluids. How do you do for E? Food sanitation, access to clean drinking water, travelers to developing countries. Of course, this is taken from a background from a developed to a developing country because the highest cases are within developing countries. You try to make sure you reduce your access to water resources that you're not confident with. Make sure that you boil and chlorinate your water, which is what is used in many tap-borne waters globally. So we've learned the following. Acute viral hepatitis can be caused by viruses. We have discussed here in this topic the hepatotropic viruses in this lecture. The viruses causing acute disease of the liver include A, B, and E, okay? Whereas C is not often recognized. D always occurs in the setting of B. The symptoms of viral hepatitis can be similar and sometimes non-specific. There are effective vaccines, I said, for A and B, okay? Please ignore that I said A and E. Effective vaccines are for A and B. I will correct that in the lectures you will get eventually. And the others are only preventable via specific routines. So A and B have got vaccines while the others do not. Congratulations on completion of this course. We shall stop at this point, and then I will expect you and many more who would be interested in joining the chronic viral hepatitis later on. I know that there are some more people who will join at that time, but I don't know your local time, but I put it here. It's going to be 10:15 a.m. So if you are in Nigeria, for example, it's going to be about your 11:15 a.m. And if you are back, just take your time from the GMT and you will not miss the chance. I will give this chance for you to give or ask questions. You can now unmute yourselves. And if you have got questions, I will allow them at this point. Thank you very much for staying with me. And I hope you have not been bored by myself. So if you want to speak, please unmute yourself.
Hello?
Hello. Hi.
Good morning, sir.
Go ahead with your question.
So I know the question will come out maybe in the second lesson, but I don't know whether I'm faster than my shadow. Let me just ask the question like this, sir.
Okay.
This in vaccination they are talking about, is it after for hepatitis B? Is it after the treatment? I don't.
Right. That's a very valid question. And I think it's correct that you actually asked the question now, because some people are confused. When you have been cleared of acute viral hepatitis B, in other words, you don't have the virus again, what happens? Are you still vulnerable? My response to that question is that you are not, because you normally would have developed the natural immunity to hepatitis B. However, if you do need to confirm whether your immunity is great, there's a test you can do known as anti-HBs antibody. That will
anti-what, sir?
Anti-HBs antibody, which will be done
HBS
anti-HBs antibody, which will determine if you have the titer, the amount of the immunity that is required. If you are in a healthcare service and the immune titer is low, you are normally advised to have a booster dose of vaccination. No harm in it. If, for example, you have had previous infection and that's persevered in your body, and you have the vaccine again, is there a problem? No, it's just that you'll be wasting the vaccine. So that's my response to your question.
Okay, sir. Thank you, sir.
Thank you.
I've learned a lot.
Thank you very much, Dr. Who else is coming?
I will join by 11:15 for the chronic hepatitis.
Indeed, thank you very much. Looking forward to meeting you at that point.
Thank you, sir.
Thank you. Have you got any questions? We will wait for about 2 more minutes and see if somebody has a lead question to ask.
Yeah, I was wondering, how common is the hepatitis A, the E, and the D compared to B and C, especially in developing countries?
Thank you very much, Amy, for this. So the epidemics of hepatitis A and E are not very common in developed countries. They are commoner in developing countries for obvious reasons, the sanitation issues and source of drinking water. And because they're not likely to cause chronic inflammation, the tendency is for these viruses to not be a priority group. And so you would not have much data in terms of numbers. However, we know that the B and C are most important. C is much more important in developed countries, whereas B is the most important in developing countries. We know that in data available to us, the D is not well studied in developing countries. But we know that in Latin America, D is very important, and also in Europe, Eastern Europe in particular. And so I must answer the question in a snapshot, I would say AB, important in developing countries, but in terms of numbers of concern, B is much more relevant to developing countries because of the association with chronic disease, cirrhosis, and liver cancer. Thank you very much, Amy, for that. Any more questions? All right, guys, I'll give you some break because you will need about 45 minutes or so to come back. We can then continue from that point. And I guess a lot more will come for cirrhosis as well. We shall have a time with all of you, and I bet you will receive communication from me after these lectures. Thank you very much for this session. I'm ending it at this moment, and will await your coming back again. Thank you very much. Sorry, there's a comment there from Gabriel. Thank you so much. Looking forward to 11:15. That's brilliant, brilliant. I know many of you will be coming because a lot of you are quite concerned about the chronic hepatitis, and we will do some